India's plan to eliminate TB. Why TB is most deadliest disease for India. Why TB is being ignored in India. What are the steps taken by the government to tackle the TB? What is the way forward for India? GS Paper 2, Issues related to health, education and human resources. What is the context about? Recently, Health Minister spoke at the World Health Organization (WHO) Regional Health Ministers meeting in Delhi on TB, stating his government's intention to address the disease aggressively. At the end of 50 years of tuberculosis control activities, the disease remains a major health challenge in India. Disease control in India is a story of contradictions, and tuberculosis, TB, is no exception. TB is a staggering epidemic that affects 2.8 million and kills 485,000 Indians, pushing individuals, families and communities into poverty, suffering and debt. Why TB is most deadliest disease for India. Many health research implicitly highlighted that from the last decade, the global burden of TB in India has increased in unprecedented manner. It can be proved by simple statistics that India, which have 17% of global population share, 20% of global health burden, GHB. TB is often considered as disease of poor, thus the large population segment of the India is highly vulnerable to it. More on India is the largest victim of the deadliest form of TB, MDR and XDR. It has been also witnessed that the nation also lacks proper kits to detect the TB at its earlier stage, which further enhance its vulnerability. Why TB is being ignored in India? Perhaps because its fundamentals are beyond the capacity of the health establishment. A lack of preventive strategies, poor nutrition, and rapid urbanization with limited public awareness all feed India's epidemic. Many of these are domains traditionally outside of disease control programs, though they have an impact on disease control. Most TB patients rarely get tested up front for drug resistance. As a result, numerous cases of DR-TB remain undiagnosed, poorly treated and often lost, or what the WHO terms missing. Efforts by government to tackle the TB. India recently released a draft of its latest strategic 5-year plan to control TB, which takes the approach to find, treat, prevent and build for TB control on a massive scale. Government has now declared TB as a notified disease. Thus it will help to eradicate the incidence at wider scale. The National Strategic Plan 2012-17 aimed at providing universal access to early diagnosis and treatment and improving case detection. DOTS and RNTCP are further comprehensive approach adopted by government in this regard. Government also started several universal vaccination program. Mission Indradhanush is prominent in this regard. What is the way forward for India? India's spending per TB patient is the least among BRICS countries. The answers lie in expanding the capacity of the public sector, aggressively engaging the private sector, increasing budgets, and creating a massive campaign to ensure awareness and empowerment among those most severely affected. We need access to a free and reliable TB test, counseling, free high-quality treatment, and economic and nutritional support. Until then, TB will continue to devastate the foundations of this aspirational superpower.